So as these patients are experiencing these symptoms, is there certain symptoms that occur sooner than others?
It depends. It depends on the syndrome, but if the cerebellum is the main target, often vertigo, imbalance, sometimes difficulties with ambulation or walking, slurring of the speech can be early symptoms.
So is it the immune system is essentially attacking the cerebellum, correct?
Exactly.
Okay.
In the vast majority of the times when patients have systemic cancers, for example, breast cancer or lung cancer, which are common, if they have neurologic problems, many times it's because the cancer is spreading to the brain, the spinal cord, or the nerves. But in paraneoplastic disorders, it's not the direct effect of the tumor, but rather an abnormal immune reaction that is targeting the tumor, but the brain cells, the cerebellar cells, are innocent bystanders in that fight.
And that's an interesting point you bring up. In the first scenario, where there's a neurological complication of the metastases, it might be later stage of the malignancy, whereas perhaps with PNS, one could argue maybe it's an earlier stage. Can you elaborate on that?
Exactly. So that's a very important point you're raising, that most times actually patients present to different specialists before they get diagnosed with cancer. So they may go to see an ENT specialist because they have dizziness and vertigo or problems with their hearing. They may present to a neurologist due to having difficulties with balance, speech, etc. And is the diagnostic work done by neurology that ultimately may lead to the identification of the cancers. And often the cancers are found at very, very early stages. So it is more common to find cancers that are limited to either the organ or just the lymph nodes. It's actually rare to see widespread metastatic disease in paraneoplastic diseases.